I am Ray Scheppach. I'm currently a professor of public policy at the Batten School at the University of Virginia, and I'm the former executive director of the National Governors Association.
For the average American, how would you describe current public policy regarding the COVID-19 pandemic?
Governors provided a lot of good leadership on shutting down, but when you get to the point of when do you open up, I think it's a lot harder decision. But as you come down now on the other side, when do you start reopening? When you're 20% off the peak or 40% off the peak or 60% off the peak. And that's why I think what you're seeing now is groups of governors and groups of states getting together. So I've been pretty happy with what I've seen so far, but I think it's going to be much more difficult coming out of the shutdown.
What can individual governors do to guarantee adequate or effective testing in their states?
This has been pretty much a mess, I think. One of the real problems in terms of good public policy in this particular area. The governors clearly felt that was the federal government's role, which was to develop those and get those distributed. And as you know, early on, CDC did not do a very, very good job. So I think that there's some tension between governors and the administration. I think we're at the point now where we've got a significant number, because a lot of the universities have developed their own tests and so on and expanded the labs.
How do you see things playing out nationwide, maybe over the next month, 2 months, 3 months? Where do you think the U.S. will be maybe around the 4th of July?
Well, I think it's going to be a lot better, but I think you're probably going to have several states that had actually moved to open up quite a bit, but you're going to find some that are going to have problems with infection rates moving back up, and they're going to have to turn around and close down a little bit more. But I'm not sure we're going to get back to normal until there is a vaccine, and that's clearly probably 18 months to 2 years away.